If you're a healthy person, believe you're invincible, whatever it may be, you didn't need healthcare at the time, you largely looked at that as saying, well, shoot, I'd rather just pay the penalty and then not pay the significantly higher monthly premium. So then you had all these healthy people removed out of this pool of people.
Sure.
So now the only people that are in that pool are people that really need it.
From Ray & Associates Studio, this is Unsuitable, a management and financial services podcast for entrepreneurs, tenured business leaders, and others who are ready to look beyond the suit and tie culture for meaningful, measurable results. I'm Doug Hauser. Employee health care in America continues to be an explosive topic, so it's no surprise that it can be difficult for employers to understand the best way to execute an effective employee benefit health plan strategy among their workforce. Today, Dean Stitz, a consultant with McGohan Brabender, the largest independent employee benefit brokerage firm in Ohio, understands the challenges businesses are facing in this area firsthand and works with companies to reveal employee benefit health plan opportunities they may not even be aware of. Welcome, Dean.
Welcome. Thanks. Glad to be here.
Awesome. Glad you could make it. So, employee health plans, that is just a scary topic for both employers and employees. I just feel like, I don't even know what I'm looking at. Talk to me a little bit about some strategies for employee health plans for, say a smaller company, below 50 employees. What makes sense there? What do you see in the market?
Sure. Well, I want to maybe make a comment on the very first thing you said about, it's largely misunderstood, like in the moment, and you're really only thinking about healthcare come that open enrollment period. What's going to be relevant? What do I need to be thinking about? And, largely healthcare is episodic. It only matters when it matters, whether you're going to the doctor at that time. So you kind of hear from an employer perspective, but also maybe more so employee. You're thinking about healthcare in that moment, but you might not go see a doctor or go to the hospital or, refill a prescription in 3 months, 4 months, 9 months into the year.
Right.
So largely, you just got to kind of be cognizant of that when you have those initial communications, and then making sure as an employer you're continuing to drive, some of those strategies that you speak to, and maybe it's the month before your renewal period,
right,
throughout the year.
So do you help folks communicate that to their employees internally as well?
Yeah, absolutely. The strategy there is to do it when you got to do it, which is when you're making a decision on what do you want to enroll in. But then also have emphasis behind reaching out to your employees kind of throughout the year, and your broker should be driving that process.
Okay.
And that whether that's monthly or quarterly, whether that's a bulletin board material, however your workforce is kind of positioned. To the question about under 50, so maybe what would be helpful is to almost kind of take a step back and say, I think kind of the reoccurring themes that you may hear about are, the Affordable Care Act, ACA, right, also known as Obamacare. So right, really said 3 different ways. That law passed in 2010, and then it was enforced in 2014. And the intent behind that was to, find a solution for many people, both employers and individuals. And in the small segment space, in the under 50 employees, I'll largely, kind of speak to small on the assumption that they're under 50.
Sure, yep.
But it's within that space that the ACA was meant to kind of be another option for you. Okay. So you can be medically underwritten, which is your employees are, judged or valued. Valued might not be the appropriate term, but reviewed for them, right? So sure, their health demographic and whatnot. And so the Affordable Care Act gave it another option, right? So you could be rated based on age.
Okay.
And the intent there was to have that pool be a very large group of people, both people that worked for an employer, but then also people on their own, whether they be a 1099 or even, just a different field that wasn't even offering health insurance.
Bigger sample size, so to speak.
Right.
So you spread the risk, basically.
The idea behind insurance is law of large numbers, right? So you had people that needed health care that were enrolling in this, but you also had people that maybe didn't need it, but there was a penalty associated for it, so they were doing it too. Well, there was a penalty that was, a number that wasn't necessarily high enough for many people. So if you're a healthy person, believe you're invincible, whatever it may be, you didn't need healthcare at the time, you largely looked at that as saying, well, shoot, I'd rather just pay the penalty and then not pay the significantly higher monthly premium. So then you had all these healthy people removed out of this pool of people.
Sure.
So now the only people that are in that pool are people that really need it.
Right.
So now there's, we kind of talk about it as an option, but maybe 95% of the time an employer in the small space looks at that as not a viable option.
Yeah.
They'd rather be reviewed for them because of the pool and what it currently looks like today. So, it's not the best of options for many people. So the process is either stay as is, what you looked like before 2014 with minor tweaks, maybe change a deductible. But you can only do that so many times before your employees really, really feel it. You can only pass on that cost so many times. Well, what about a third option? To quickly kind of go into that, it's called a MIWA, which stands for Multiple Employer Welfare Arrangement.
Okay.
Essentially what that is, said simplistically, is a lot of small employers joining forces to operate in large number.
Okay.
So a carrier would rather rate that large group, say 40,000 employees, versus the 40.
Again, it's the larger sample size, so you're spreading that risk, and it's more cost effective for everybody.
Correct. Yeah. So that's kind of the, when you're a small employer, you feel very handcuffed. That's a very bona fide solution here over the course of the last 4 years.
Okay. So you've seen those grow in popularity. Okay.
Yep.
Now, how do you get involved in one of these? I mean, is that obviously you guys do this stuff?
Right.
So
Yep. We actually were we created the very first MIWA in the state of Ohio. Yep. So we were behind that plan, and that was the SACA plan, which is Southern Ohio Chamber Alliance.
Okay.
And essentially, you can be a member of approved chambers, trade associations.
Okay.
You and I are both involved in the Builders Exchange.
Yep.
And within that Builders Exchange arrangement, grants you access into a pool like that.
Okay.
So the carriers have, most of the carriers, major carriers, have an option kind of within that realm of quote unquote MIWA.
Now, is the coverage under a plan like that, is it typically comparable to what you'd see as an employer, a small business, their own plan type of thing?
Yeah, absolutely. Quite frankly, if you're willing to kind of go through the effort of filling out the medical questionnaires, which requires all of your employees to do it, it's the number one thing that we would suggest looking at.
So you can get all the typical different options that you might have, different levels of deductibles,
right? Yep.
Copays and things like that.
It's not like you're kind of joining a group and the only way that it's going to work is if you just pick between these two ideas or two plans. There's plenty to kind of pick between, to almost maybe outside of a few tweaks, and I'm talking minor. Plan design changes. You'll find one very, very comparable to what you're currently offering.
Okay, that's great. Yeah, great option. Now, what about as we move up the food chain a little bit? So if you get into, more mid-sized businesses, what other options are there for those kind of folks?
Each segment space, and I'll say 2 to 50, 51 to 99, and 100 plus, kind of all have different rules and regulations. A lot of small employers kind of fret the 50 mark.
Yeah.
Because it does change. But said differently, I think it really opens up opportunity.
Okay.
Options are king. Absolutely. In the small space, you only have 2 or 3 or 4. You feel very limited, very handcuffed to your reality. In the medium-sized space, it really opens up. And so maybe think of it on like an XY axis.
Okay.
Risk and reward, respectively. Yep. Fully insured is, you're paying a monthly bill. At the end of the year, you have a renewal, and you kind of rinse and repeat. Right. Outside of, hey, broker, go beat this up for me. Right. I mean, we all can do that.
You hear that every year, right?
I do, yeah. It's like, well, how about we talk about the value add that we actually do on top of all that? Right. That's a sales guy's wishful dream. But when you think of it like that, so I kind of said there are 2 or 3 options in the small space. I'm going to loosely say maybe there's 8 or 9 in the medium-sized space.
Okay.
And so think of it kind of from a linear progression, fully insured being low risk but low reward. Paying probably a significant renewal come every, renewal period, quite frankly, all the way up to what largely was previously only discussed in the 100 and above space.
Okay.
Fully self-funded, reference-based pricing. I mean, there's kind of, those are animals in their own right, and the more risk appetite you have, the more cash flow, the more those make sense.
Okay.
But in that medium-sized space, we can review those with employers, and that's kind of, maybe 10 years ago, we weren't doing that.
Okay. So there's more options for them. In other words, if they have, if they're fairly profitable, have a lot of cash flow, because the expense to them might be very different from year to year. Is that why you say that the risk?
To be self-funded, to not get into the weeds, to be self-funded, you're paying for your own claims.
Right.
So although you still put insurance on top of that, a bad month looks a whole lot different than a good month.
Yeah.
So that's kind of where my cash flow comments,
Gotcha.
are driven from.
And they can put obviously a cap on the high end.
They can, yeah. But that cap still it can fluctuate.
Okay.
So, smaller employers might not have that risk appetite or tolerance in order to do something like that.
So in the mid-size space, what are you seeing? What trends are you seeing in there in that 51 to 99 type size company?
Yeah, so previously maybe we would just label that pretty simplistically fully insured. A lot of employers just kind of paying your monthly bill. At the end of the year, you get a renewal. Like I said, you beat it up and you kind of say yes and you move on. More employers are making changes.
Okay.
Consumer-driven healthcare, high deductible health plans are all kind of putting more emphasis for an employee to kind of think twice about what they're doing. So you're seeing a lot of, I would say maybe that was the strategy over the course of the last 5 years. You've seen a lot of employers, move into that direction. And quite frankly, we'll look at TVs till we're blue in the face when it comes to like which one I want to go buy. But when it comes to going to see a doctor, it's like, well, now I got to go and I don't have a primary care physician set up, so I'll just go to the emergency room.
Wow. Yeah.
And the idea behind the high deductible plan is now you might have, hopefully you're getting that person to kind of think twice before they go do it. So then maybe it's your urgent care.
Right.
Or quite frankly, it's truthfully trying to set them up with a primary care doc.
Yeah.
So that way they're going there first. If we're really getting kind of techie and new age, it's even teledoc type deal.
Okay.
So like the very first conversation you're having is with a guy within 10 minutes on your phone, and he's telling you to go, and you're literally looking at him, through your telephone.
Wow. Yeah.
And in fact, this past summer, I had an eye infection. It was pretty gnarly. But I'm going to be a really good consumer of my healthcare, right?
Sure.
It's what I preach.
You're in the business, right?
I got to go do it. So I called the teledoc, and it's $0 to call him. It's significantly cheaper for the employer. So there's incentive to want to lead me there.
Yeah.
So I call and I'm thinking like, I probably need to go to urgent care at least, but you know what? I'm going to call the teledoc.
Yeah. See how this goes, right?
Yeah. So he's reading my quick little bio, right, of what's going on. He goes, so it sounds like you have an eye infection. He goes to look up and he goes, oh my God. And, he just kind of stops me mid-sentence and says, yeah, we're going to end this call. You're going to go to the emergency room.
Wow. Right there.
And, that was first round of consult. Like, if I had the sniffles, he would have told me, here's the script.
Yeah.
Right? He would have told me to go, and, he would have diagnosed me and maybe written me something or, maybe just said, go back to bed. Right? So.
Are you seeing receptiveness, though, to these types of things? I mean, I see what you're saying, though, about like, if they're buying a TV, they'll go research the hell out of it. But for that, it's like, I'm not doing that, right?
Yeah. When you talk about, show me another industry that's increasing to the magnitude that healthcare is.
Yeah.
You won't find it. Largely, a lot of employers have had to kind of redirect their paternal, focus, saying, hey, I'll incur all of the expenses myself and pass a little bit of it on to the employee. So as far as utilization goes, to your question, I do see trend leading to that employee engagement. And that largely goes back on communication. And it's not just in the month of December when you renew in January saying, hey, call the teledoc. It's throughout the year. It's on your bulletin. I work, largely in, quite frankly, all industry, but in the construction space. And, it's just engaging those guys. Maybe it's in their, monthly safety meeting.
Right.
Bringing us out, bringing the guy, wearing the suit out saying, hey, this is what you need to be doing in this moment. You might not think you need to do it right now, but like a week from now when I'm not around, you'll remember the conversation that we just had.
Yeah. That's excellent. So they've got more options in that kind of mid-size space. Are you seeing trends in terms of what percentage, say, the employers are paying of the coverage versus, passing along to the employees? Is that shifted over time or remain flat? Where do you see that?
Yeah, it's definitely shifted. You hear less and less about an employer paying 100% of the health care. I'd say a decade ago, before I was in the industry, you had a higher clip of employers that were doing that.
Yeah.
So there's definitely been a trend away from, employer coverage.
Yeah.
It's without a doubt still labeled employer coverage. The $4,000, I'm loosely using a number,
right.
The $4,000 an employee might be paying it by the year's end because they have a $4,000 deductible and they had a bad year and they had to go to, see the doctor and they had a lot of, maybe 2 or 3 major episodes. The employer is on the other end of that paying $16,000.
Yeah. Yeah.
So certainly seeing trend only go one way. I mean, and not to kind of get on the McGohan Brabender horse or anything, but we really push our clients to kind of think, how do you want to pay for this? How far are you willing to go? And are you serious enough to address this? And then I'll even, I'm a bit of a gambler and I like to play blackjack. So I'll even kind of use a blackjack parable. My strategy is, and it's not much, but when I'm up, I'm playing with house money, right?
Right, yeah.
And I play a little more freely.
Sure.
I don't have to think maybe quite as hard as what I want to do.
Yeah.
Maybe I don't play by the card quite as much.
Yeah.
And that might have been, historically, this was a line item that we could afford.
Right.
But over the course of the last decade, seeing, trend exponentially increase, employers now are kind of they're kind of looking at this thing differently, or they need to be.
Yeah.
And, maybe a couple of years they weren't, but now here they are, their stack is half as high.
Right.
And they're looking at this thing with just laser focus, right?
Right.
And, maybe their existing broker relationship for decades has been a solution for them, but now it's like, we got to look at this 2 times, 3 times different ways. We need to know what else could we be doing.
Well, to me, it goes back to you need to be a specialist. We preach that all the time. We have there's other firms out there that try to do everything for everybody, and I always say that's a mistake. I mean, you can expand what you do certainly to some degree, but you got to remain an expert and highly valued at what you do. And for you guys, this is all you do, right? You only do the employee health plan arrangement. So I think that's unique because you don't see that a lot. When I talk to companies out there, closely held businesses, they're like, oh yeah, we have our firm that does this. They provide our insurance too, and property and casualty, and they've got something they recommended for us. And you're thinking, what are they not seeing, right? There's so many different things that I can't imagine they just have no knowledge of. Mm-hmm. That's important, I think.
We know what we're good at.
Yeah.
We stick to it.
Yeah, absolutely. So talk to me a little bit about large employers. So we touched on this just briefly, but if you're looking at options there, if you're over 100 employees, I've heard self-funding become more prevalent. So what are some options that a larger company might have?
Yeah, so to kind of go back to the story kind of that I told about, risk appetite evolving as you get larger in size, more cash flow to help kind of make those decisions as you navigate up that XY spectrum. To self-fund your claims means options. Like I had said, options are king. So now you're kind of operating on next level, almost like outer space level of options. You're waking up to make widgets, whatever it is that you do for, as you run your business. So you're leaning on the us's, right?
Right.
I just made up a word. You're leaning on us to kind of be that guy that comes to the table saying, hey, this is what's going on out in the market. This is an avenue. This is an option. Because it's kind of yours to define when you're self-funded. You kind of have the most chips in your corner. And like case in point, so orthopedic surgery is, so let me even take a further step back. 18% of the GDP of the United States is healthcare.
Wow, yeah.
Orthopedic surgery is 4.7% of that. To put that into perspective, our food is 5%.
Wow.
So orthopedic surgery is almost comparable to food.
The GDP. That's
and
crazy.
What if I were to say 70% of that, $900 billion, keyword billion.
Yeah.
So 4.7% equating to $900 billion. What if I were to say 70% of that was avoidable?
Wow.
And so, in the fully insured space or in these kind of like in-betweener type spaces, this option doesn't exist. But you can, the word I'll use is kind of carve out what your benefits program allows.
Yeah.
So kind of within this space, there's orthobiologics that are out there that essentially replace the invasive surgery with a non-invasive procedure. You're not even knocked out. And the recovery time is substantially shorter.
Wow.
The cost is a fifth, a fraction.
Yeah.
So it's a win-win.
Yeah.
Your employee doesn't miss time. We always try to quantify, what time missed even means. Difficult to do.
Right.
But it's a number, right?
Yep.
So a number plus, 70% of 900 billion. Put that in your pipe and smoke it.
Right. There you go.
I mean, that's a big deal. And that's just one of many options.
Yeah.
So, I mean, we see employers kind of having those conversations for the first time, But in our world, you know, we're kind of staring at like a lack of transparency, right? And you're starting to see it on 60 Minutes. You're starting to see it kind of out there in the market. You know, whether it's a drug. I'm a type 1 diabetic, so I'll use insulin, for example.
Sure.
10 years ago, a vial of insulin was $40.
Yeah.
It's over $600 now.
Yeah, which is insane.
All that's happened over those 12 years is we've gotten better at making that stuff.
Right.
But we've been acquiring.
Yeah.
Right. Yeah. So the drug manufacturer that initially created that, you know, vial of insulin, 3 kind of came out and they helped push that price down.
Yeah.
And then that one of those 4, right, bought the other 3.
Sure.
And then jacked the price back
Consolidated it.
Yeah. There's such little regulation in that space.
Yeah, that's insane.
And so, I mean, when we ask ourselves, where are these cost increases coming from?
Yeah.
You don't have to look very far. But the difficulty is just really being able to call a spade because it's just largely not easily visible for us for us to review.
As you said, it's not transparent at all. And if folks don't know about it, and there's no incentive because the companies that control that market obviously want to keep that market in place. It's very profitable for them. So, you know, I think the lesson here is you got to get back to getting an expert like yourself at the table to go over all these different options, because so much of this stuff, I mean, we could probably go on for hours and hours. You're not even aware of, you know. Mm-hmm. And whether I'm a small employer, medium-sized employer, large employer, I want to have all my options laid out for me and understand the risks and understand the costs and benefits, and then make an informed decision, right? That's what it's all about.
Absolutely. And when you give me a soapbox, I can largely leave people a little depressed, like, holy smokes, the cost is only going one way. Like, what are we going to do here?
Yeah.
Options exist. Let me just start out by saying that. Options exist. I mean, it just goes back to one of the questions that I kind of, rhetorical question, like, how far are you willing to go?
Right. And, of course, who knows what kind of changes are coming. I know the ACA is under attack in the courts, and, you know, we don't even want to get into the political environment and what's going to happen with all that. Who the heck knows, right? But
I'm purple. I'm not red. I'm not blue.
But you can only plan for what we know today. And like, as you said, there's a lot of options. So I would encourage business owners to reach out to Dean to have a better understanding. So that's great information. Thank you very much, Dean. And if you want more business tips and insight, or to hear previous episodes of Unsuitable, visit our podcast page at www.raycpa.com/podcast. Thanks for listening to this week's show. You can subscribe to Unsuitable on iTunes or wherever you like to get your podcasts, including YouTube. With the holiday season now roaring along at full speed, we will be taking a few weeks off from producing Unsuitable to enjoy some quality time with our family and friends. I hope you have plans to do so and do the same. From all of us here at Ray & Associates, we would like to wish you a very Merry Christmas and a Happy New Year. I'm Doug Hauser. Join us on January 7 when we return with a new Unsuitable interview from an industry professional.